Okay, thank you for your question. My name is Reverend Joseph Kariuki, the Vice Chairman of Rural and Urban Private Hospitals Association, in short is RUPHA. Talking about this issue of non-payment of SHA and NHIF legacy debts is a big problem to facilities because the facilities find it very difficult to operate without payment, without cash. We are short of consumables. We are short of paying for our bills. We don't have money to pay salaries. We have issues with the loans in the bank. A number of our facilities have a problem with suppliers, and they have been taken to the small claim courts. The issue is big and is dire, and we can only look forward to have payment done the soonest possible. Like I've explained, we are having problems with the cash flow. We don't have money to buy drugs. We don't have money to pay staff. Our rents are accruing every day. We have constant threat with the auctioneers. I've also mentioned that a number of our members are in the small claim courts, being pushed left and center by suppliers. And the situation is bad because every day you wake up to a problem. There is no solution foreseen. And so the issue of non-payment to facilities cannot be overstated. It is dire and it is necessary, and it's time that SHA and the government looks at ways that they can do this to pay. We were promised that the 10 million and below will be paid immediately. We are actually running to a whole year now without seeing that executive order implemented. We are asking the government to not just mere giving promises, but go ahead and fulfill the promise. This executive order needs to come so that the facilities can be able to come up again and fill in the holes that are already there in the healthcare sector. Quite a number. Within our network, RUPHA, we have 174 facilities that have closed in the last 12 months. 174. And that's not just a number. Those are businesses, those are enterprises, those are people who have lost job, those are loans that are accruing and there is no means of paying. It is a big, big situation. And a number of facilities are really in a difficult situation. RUPHA360 was inspired by the idea of having, promoting equity of quality of care among all the classes of people in the country. Like you've noticed, the premium is targeting the lower cadre in the society. And we are looking at having them accessing quality healthcare through the private facilities that they were used to during the days of NHIF, to continue with the quality of care to their families. And so RUPHA360 is coming up at a time where this demand is very much expected to take root in the communities. When we hit the road running to promote this product, it will resonate with the people in the community. Indeed it is. RUPHA360 is a new chapter in healthcare, because for the first time in the country, this is where Kenyans will be paying money to a private insurance at the cost that they can afford and get services in turn. When we talk about RUPHA360, we are actually talking of a product where a common mwananchi will be paying 61 shillings per day, and they will enjoy a cover for a family of 4. This is really a game changer in the health sector, and especially insurance. It's different. Like I've mentioned earlier, look at the premium, 22,200 for a family of 4 per year. It doesn't compare to many or to any in the market. Again, we have brought in the aspect of IPF. We have brought in the aspect of paying in installments, which most insurances do not do, where you can even pay your medical insurance per day, where we are paying 61 shillings per day. This is really a great thing, and it is one of its kind in the economy of Kenya. Yeah, the reason is simple, because when you focus on the chronic illness, you discover that this is where Kenyans are ushered into poverty. It is in the chronic illness. We say that every family is just a sickness away from poverty. And malaria doesn't do that much. Flu won't do that. But when we talk about cancer, when we talk about this mental illness, these are conditions that consume a lot of money, whereby you find that someone will have to sell a property to take one of their own to hospital, maybe for chemotherapy, for radiotherapy, and dialysis, and all those things. So by the introduction of RUPHA360, this is a product that is coming with an element covering chronic illness, which will be able to cover families from catastrophic financial loss. Actually, the thing is, most healthcare workers in the private sector will retire without anything, not even little. And we discovered that as one of the ways to motivate our staff, to motivate those who work in our ranks, is to have a thought on their future. And we said, if we can have this pension scheme for them, even when they have worked for us for 10 years, 15 years, 20, and they go home retired, they will be having something in their hands. We have looked for a company that will utilize this money well, invest it well, so that it generates more interest and more income for them, even as they retire. You discover that even when you retire and you don't have cash, that could be a source of sickness. Yeah, so you need something that you can be able to buy some vegetables here and there after you have been retired. Absolutely. If you don't have money, you are sick. Yeah. When you can't buy some simple things that you need, you can't pay for your own fare to move from one place to another, and you have been working for the last 20 or 30 years. I mean, that one will bring some stress to you. You are likely to suffer some mental illness, other than other things that come out with a lot of thoughts and thinking and stress. Digitization, especially in RUPHA360, we are bringing together the expertise and the experience of RUPHAsoft and LCT Africa, which is a company of Liaison Group. When we bring these elements together, we are trying to cure the problem of delayed payments. We're trying to cure the problem of rejection of claims, the problem of reconciliation of accounts every now and then, because digitization will ensure that payments of claims are paid in real time. Right now we are looking at 30 days. And in the first quarter of next year, we will be bringing it down to weeks. And thereafter, we want to see that it will be paid within 48 to 72 hours. And that is the importance of having digitization in healthcare, because it facilitates cash flow within facilities so that they are able to do what they need to do and continue giving the quality of care that they're expected to give. Absolutely, because the claim process begins at the facility. And once the claim is lodged, it gets to the insurer or the payer in real time. And it is processed within hours. And if there is a problem, a document is not attached, maybe there are some things that are not uploaded but they are not clear, the payer will be able to send back the claim to the facility within 24 hours. And the facility will respond within 24 hours. So within basically 3 days, if there is a problem, you will find that that claim will be paid. And so that problem will be eliminated, and we will not be having problems of delayed claims, rejected claims, and all those problems that we're having right now, especially with SHA, because the things will be done right on time. It aligns very well because, number one, it provides a space for the private sector to work hand in hand with the government in realizing the UHC. And number two, it provides, or rather promotes, equity of care among all the people in the community. We have extended this to the last man in the community, every family that feels that they may not be able to afford whatever the 1 year payment in SHA, then they can come to this RUPHA360 and they can benefit like any other family. Quite a lot. Like you may be aware, advocacy is one of our pillars as an association. And we have talked to all the people that need to be talked to. We have written letters, we have engaged in meetings, we have sent emails to government showing them the need to pay these payments in time and in correct measure, because sometimes, yes, they make payments, but they make 10%, 20% of what is owed, which does not actually help the facility. So we have actually engaged the government, and we have done the best that we could. And the last thing that we did is to tell our members to work carefully with SHA, because the government doesn't seem to hear what we are saying. And if we continue giving service and we are not looking at our liability, we may end up in a bad situation. So in the month of September, we advised our members to only carry SHA liability that they are able to carry. If you get to a place where it is not manageable, stop it. Again, the SHA contract allows facilities to co-charge. And that's the direction, again, we have advised facilities to ask for a co-payment when SHA members come to the facility to help in these cash flow problems. RUPHA chose Liaison Group, number one, because of the history that Liaison has carried over a period of time. Like insurance is a business of trust. And the Liaison has been able to build the trust among the public for many years, many decades, so to say. And it was very easy for us to also trust them and the history that they have been in this business for long. Again, they are very flexible in terms of listening and understanding the direction that businesses are taking. We've been able to sit in long hours of meeting just to craft up our program, and they were not tired. They were, following and until we came up with this product. So Liaison became a very, very solid partner to bring out RUPHA360 because of all those things that I've talked about. Again, they also have the LCT Africa, which is a company that works with the digital health, and they've been able to run many other programs, including the judiciary and a number of counties' health schemes. And for us, we felt like they are the right people for us to work with. The future is bleak, but that's what we are trying to navigate through when we introduce RUPHA360. Healthcare is not all about SHA. There are many other ways that we can diversify and improve our cash flows and continue being afloat in business. So the future may be bleak as far as SHA reforms are concerned. But we want to change the way of thinking of our members so that they may look at other areas that they can be introduced to and do business, the same business, reach out to the same community and offer the service they offer and remain afloat. So it is actually a business decision that our members will have to make to remain afloat by choosing the option of RUPHA360. We already have a very good framework in terms of a legal framework. We already have wonderful packages that we can work with. So our only problem is on the claims, the processing and the payment. Government procured a very expensive system, a 104 billion system that they have either not utilized properly or they have refused to use it, where claims are supposed to be processed in real time and payments done in good time so that we don't have facilities struggle with cash flow to offer services and participate in the UHC agenda. My message will be to encourage them and tell them that all is not lost. We have challenges with SHA. We may not know when we will cross that line and say we are past it. But even as we do that, RUPHA as an association is providing alternatives for all healthcare workers and facilities to remain afloat in business. We have this RUPHA360 that they really need to check out and make sure that they participate in. We have RUPHA which is the hospital management information system that is born and bred at RUPHA, where members can pay very affordably and enjoy the benefits thereof. It is the only private sector system that is connected to the KHIE, and that makes it very, very marketable and efficient. In RUPHA, we have RUPHA Drug Agency, whereby we use our economies of scale to source for pharmaceuticals and non-pharmaceuticals for our members at a very discounted rate. We have many of these options that are available in RUPHA, so facilities don't need to struggle out there. Those who have not joined RUPHA, this is your time. Come join a place where your voice will be heard and you will enjoy all these benefits as you navigate through these challenges of the SHA as it is. Now, RUPHA, we have come up with a very strategic strategy. It's called the RUPHA Wilderness Experience, or Wilderness Strategy. We recognize that we are in a wilderness, like the children of Israel on their way to the promised land. So the promised land is ahead. We are in the middle of the wilderness. There is a strategy that we have put in place for our members and those interested to plug in so that together we move through this wilderness. We fight through all the challenges and eventually we find ourselves in the promised land, because we expect that come the second quarter of 2026, a number of us would have shed off the burdens of the wilderness experience, the burdens of cash flow problems, and come June next year, a lot of them will benefit from this.